Hey there, Scott again, and today I want to talk about the myths of type 2 diabetes. This condition is surrounded by various misconceptions that may even sound absurd. For example, that diabetes is contagious, or that people with this condition are dangerous drivers. Now, of course, both myths aren't true, but what are some of the other most common diabetes myths? Let's do some fact checking today. So here we go. Myth number 1, eating too much sugar causes type 2 diabetes. Now, I can agree that it may seem like an easy target when talking about diabetes, but I'm going to be honest here. Sugar itself isn't the culprit. Some other risks of developing type 2 diabetes are weight gain, increased body fat, heredity, and inactivity. So it's basically a variety of issues that causes the condition. Now, it's true that you gain weight when you take in more calories than your body needs, and sugary foods and drinks contain loads of calories, but it's more important to match your calorie intake to your body's needs, not just cutting sugar out completely. However, if you notice that sugar in particular is making you put on weight, then you're increasing your risk of developing type 2 diabetes. Now, myth number 2, type 2 diabetes only affects people who are overweight. As I mentioned before, being overweight or obese is a serious risk factor, but it's also possible to have this ailment without having weight problems. In fact, around 10 to 15% of adults with type 2 diabetes, they aren't overweight at all. This shows that other risk factors, such as family history of diabetes, physical activity, high blood pressure, ethnicity, and age, well, they also play a role. All right, before heading to some of the other most common diabetes myths, make sure to subscribe to the Klinio channel. We make complicated topics about diabetes simple, so don't miss any of our videos. We have several more still to come. Okay, now let's move forward to myth number 3. Type 2 diabetes isn't a serious condition. Well, unfortunately, it is a serious chronic disease, and according to the American Diabetes Association, this condition causes more deaths every year than breast cancer and AIDS combined. Also, diabetes nearly doubles your chance of having a heart attack. Furthermore, all types of diabetes can have various effects on your body, such as kidney disease, eye problems, high blood pressure, tooth and gum problems, skin problems, sexual dysfunction, and so on. All right, I don't want to sound like a complete pessimist here. I just want you to be aware of the possible complications that may arise when you have diabetes. On a more positive note, if you manage your diabetes by making lifestyle changes and by carefully listening to your doctor's recommendations, you can highly reduce your risk for those serious complications. Okay, myth number 4. People with diabetes can't eat carbs. Believe me, there are plenty of diabetes patients that eat carbs, and they're doing perfectly fine. And it's only because they're doing it the right way. Everyone needs some carb-containing foods in their diet. And for people with diabetes, the quality of the carbs is more important to their health than the amount they eat. So if you're eating the correct carbs and combining them with healthy fats and proteins, along with exercising and managing your weight, you'll be able to handle your diabetes without going totally carb-free. So again, you need to understand that it's not just a food problem or just a fat problem, it's an array of several different factors. And finally, myth number 5. People with diabetes need to eat special foods. Well, come on, diabetes management doesn't work like that. It's a total misconception. Diabetic people can eat just like people without diabetes as long as they consume healthy and whole foods. So you definitely don't have to go and spend a bunch of money on so-called diabetic foods. First of all, if the label says diabetic, low sugar, or no sugar, then the price suddenly goes up, sometimes by double. Secondly, foods with special diabetes-friendly claims may still raise blood sugar levels. But if you still want to try these out, then read food labels carefully. And as I said before, a healthy meal plan for people with diabetes is generally the same as healthy eating for anyone. So you basically need to include lots of non-starchy vegetables, limit added sugars, swap refined grains for whole grains, cut out processed foods as much as possible, and prioritize whole foods over junk food. If you're still confused about diabetes foods, watch the next video about the best and worst foods for diabetes, and the following one about reading food labels. That's it, and we'll see you next time.